Texas and the nation is faced with an epidemic of obesity. In my region, 6 states, which are Arkansas, Louisiana, Oklahoma, New Mexico, and Texas, the state obesity rates for all age groups are all near about 30%. As we all know, children who are overweight are more likely to develop diabetes and other chronic disease risk factors. So the inactivity and poor diet that causes at least 300,000 deaths a year in the U.S. also, as Dr. Coe mentioned, is related to diseases that cost the U.S. economy more than $147 billion every year. In Region 6, we have been working locally with mayors and communities who are looking to improve the health of their communities. 3 of these entities, including some of the tribal governments that we work with in this region, have received the Communities Putting Prevention to Work grantees from CDC. The Jemez Pueblo in New Mexico is focused on physical activity and healthy choices for their constituency. The Cherokee Nation in Oklahoma has focused on media strategies to promote healthy food and beverage choices. And one of the entities in Texas, in San Antonio, was highlighted by the Restaurant Association voluntarily changing their menus to be more healthy for their community. Another example of some of the great leadership in our communities includes Mayor Cluck of Arlington, that's in Texas, who provides students with pedometers each summer, and he challenges them to track their physical activity. When they return to school in the fall, the kids with the most recorded steps are recognized for their efforts. They have also improved the menus in the schools to healthier choices, and they are a Let's Move city. In Little Rock, Arkansas, the mayor hosted the first Healthy Food and Active Living Summit that's working to address food deserts, improve access to full grocery stores in the underserved neighborhoods, and to eliminate health disparities, among other things. It was my pleasure to host Secretary Sebelius, and she joined me for that event in Little Rock. And also the city of Brownsville, who is a Let's Move city, created walking paths that have revitalized parts of their city. They engaged the community in the Biggest Loser competition, which was fun for the community, and created an award-winning farmers market, which promotes fresh produce with the use and engagement of local farmers, and the use of SNAP, the Supplemental Nutrition Assistance Program funds. 80% of Brownsville is either overweight or obese. The Brownsville School District has been engaged with CATCH, which is the program that we're going to hear about in a few minutes. The science of CATCH is demonstrating that behaviors such as physical inactivity and eating foods in high fat can be challenged and changed. So it's my pleasure right now to introduce to you Dr. Deanna Holscher, who's the professor at the University of Texas Public School of Public Health, and the director of the Michael and Susan Dell Center for Healthy Living, who will speak in more detail about the CATCH program. CATCH stands for Coordinated Approach to Health Science, and it is a coordinated school program that builds an alliance of parents, teachers, child nutrition experts, school staff, and community partners to teach children and their families how to be healthy for a lifetime. So we're pleased to have Dr. Deanna Holscher in Texas to help lead this program. Dr. Holscher?
I am pleased to be participating in this wonderful webinar series. Today I would like to talk to you about a program on which I have worked during the past 20 years, the Coordinated Approach to Child Health, or CATCH. CATCH is modeled after the CDC's Coordinated School Health Model, which seeks to promote physical activity and healthy food choices through a coordinated effort, in which a child is surrounded by consistent, healthy messages at school and at home. CATCH includes separate programs for classroom teachers, child nutrition service employees, PE teachers, school administrators, and families, as seen in this slide. CATCH's coordinated by a program champion at each school who organizes the Catch Committee along with representatives from the other school components to implement the program, along with support from district-level administration. Classroom curriculum components include behaviorally based curricula for each grade level, from Jump into Health for kindergartners to Breaking Through Barriers for 5th grade students. Materials supporting the other components include activity boxes for the PE teachers, nutritional guidebooks for the cafeteria, and take-home family activities, as well as family fun nights or health fairs that bring the families to the schools to celebrate healthy living. CATCH began as the Child and Adolescent Trial for Cardiovascular Health, which was a research study funded by the National Heart, Lung, and Blood Institute of the National Institutes of Health, or NIH. CATCH was designed to extend the research of the 1980s.
Now that would help you call, some of you are prone to seizure. That definitely would help you have a seizure, wouldn't it, the way that thing's flickering.
First, it used a rigorous research design involving a large number of schools, 96 schools across the 4 sites you see on the map on the slide. Secondly, the intervention included actions at multiple levels and components over 3 years involving 3 separate grade levels. And finally, CATCH was one of the first studies to focus on children from ethnically diverse communities in California, Minnesota, Texas, and Louisiana. The NIH research funds for development and testing of CATCH were leveraged into a robust evidence-based.
We'll stop watching that because I don't want to cause y'all to have seizures. They couldn't help it. It was flashing a little bit. I don't know what the deal is. It was probably something with the transposing the YouTube. But you know why I share that with you? Is because that was a video stream that was focusing, and some of you guys might have to move away from the wall, from where you're sitting, because they're opening up that space helping me out here so that we'll have that dry eraser board. But I share that with you because the initiative of Healthy People 2020 and the amount of focus that Texas has on the concept of obesity. Let's see now, which is the fattest city in the United States?
City?
We were, I think we moved down the list. Is it Houston? Houston or?
I thought it was Madison.
Huh? Where?
I thought it was Madison, Wisconsin.
Oh, is Madison, Wisconsin taking over? Maybe they take a little turns. They got cheese there. But San Antonio, you know, we've had our turn.
I think we was number 3 or 4.
Yes.
We was always 3 or 4.
We're up there, guys. Those tamales, right? The lard.
I think
right?
it's Mississippi and
Right,
Alabama
lard,
is
the
number.
lard to make the tamales.
They say it's Mission State.
I think Mississippi was Alabama was the.
Guys, we have to embrace this Healthy People 2020 concept because we realize that obesity is what is going to be driving the healthcare costs. You all acknowledge that, don't you? Obesity leads to chronic health conditions. It's just, we've got to embrace and accept and acknowledge. Am I obese? Yes. If I did my BMI, I fall into the obese category. I have to take responsibility for myself. I need to do that, don't I? Yes. Yes, Dr. Moore, you need to do that. Yes, Dr. Moore, you need to be more responsible. Yes. Yes. But if we have to start this frame of reference, trying to help from children up, teaching new parents healthy choices, the importance of activity, not being couch potatoes. Like what we've had a generation where we've done this to ourselves. We must avoid that. Oh, this reminds me of Dom. She was feeding two at the same time. The nursing home, right? Yes. Many of y'all were just feeding your residents because they're so feeble they can't get the spoon up to their mouth. Don't you think that that's a lot of their problems, to be honest?
Mm-hmm.
When you don't have nutrition, after so long, don't you get depressed? I mean, if you could think about it that way. Your mindset, you just sort of start, your body starts shutting down and you become without emotion. Your affect is flat. You're depressed. When you are without those basic needs, it's depressing. No wonder. Yes, what now?
The food they give them looks so disgusting. Like, I wouldn't want to eat it.
You are going to be a BSN in charge of a nursing home one day.
Probably.
Yes. What will you make sure? You will, that will be something of very vital importance. Yes. Are you going to be, you're going to be a DON of a nursing home? Yes. Say yes, Ryan. Yes. That could be one initiative. Your nursing home has the best fresh food in the whole city. That's what you can boast about. Have a nice, I mean, Autumn Winds isn't it a nice scenery? It's a nice scenery. But if we could combine the nutritional, and they do sometimes where they do cookouts, yes.
I was wondering, this nursing home, are these old folks who are being paid by their family members to do that?
Some cases, family members are paying the monthly bill. Some cases, they are there because there's no family members left to take care, to help them. So they have to go to a facility. Sometimes they choose that. Sometimes these they become wards of state. It depends on places that you'll go, and I will tell you, Autumn Winds is one of the nicer nursing home facilities. I will tell you that. I will tell you.
Also, when I get ready to go to Oak Wells, it's not that nice.
No, I don't know. I've never been. I think it's probably just as good. I will tell you to have an opportunity, if you can, to drive on the east side.
Do they have pets at Oakville Farm?
I don't know, but they do at Autumn Winds.
Yeah, we found out that. People are allergic, that's why I'm asking, so they can be prepared for that.
Oh,
Yeah, we.
I don't know. Did we have some allergy students at Autumn Winds?
Yeah.
Who do we have? We need to. Oh, are they in my group?
No, we're in this
Woods? Oh, y'all might need to do a switch then. I can't tell you.
And they have animals.
Oh, see? I didn't know.
I know cat.
I didn't know we had some severe allergies. That is something that we need to discuss. You guys need to bring this up. Huh? Oh, I love that little Boston Terrier that has to be right outside, right? Well, you know, just never thought about that. But if you do have, guys, listen up. If you are one that has a severe allergy and that doesn't fit for you, probably Oakwell Farms doesn't have pets. That's one of the first facilities that I have seen that has pets.
I think they're Oak Wells.
Yeah.
Mr. Whitehead was Oak Wells.
Oak Wells is living homes.
That's why nobody wants to do it.
Yes,
They allow their kids.
the residents to have their pets. Yeah, assisted living. It might be that Oakwell Farms doesn't have any pets. Please follow up.
Well, that'd be nice though for them to have that.
Yes,
Yes, so you know.
nurses that have severe allergies to pets couldn't work there, could they? So those students that have severe allergies, you might need to email your email your clinical instructor now and say, what kind of arrangements can we have? Because I don't want to go in anaphylaxis.
Not just that, but those who have family members that they live with. Because I had dander on my uniform when I went home, and I did the change thing and everything outside.
Outside.
But my boyfriend has bad allergies, and he was still sneezing and stuff from it.
Wow,
So,
that's pretty serious.
yeah, he has bad allergies, dander. So,
Huh. That's something we've never thought about, to be honest. We just started using them last year, actually. But it's some of concern. I ask that those that have this concerns, please, today, email your clinical instructors. And I need, likewise, Mr. Whitehead and Dr. Diaz's students emailed. I need y'all to email them and say, do they have pets? If you have a severe allergy, because autumn winds, yes, they have the pets. They have the birds and the cats and the dogs.
Oh, Lord.
Yes, we have them all. Fish? Well, yeah, I'm not sure about fish allergy, but I guess there could be.
Let me do
I
this.
guess there could be. So guys, please do that. And by Wednesday, if we need to make switches, if we need to make changes to our clinical groups, we need to do this. We need to do this now. I will email Ms. Alcazay and the other instructors to tell them what you all told me. And then, but I have to ask y'all to email your own individual clinical instructors to say, maybe you need to have a leader in each clinical group that will agree to email the instructor to say, this person has severe allergies to pets. We cannot go to Autumn Winds and need to be moved to Oak Wells. Does Oak Wells not have pets? During our break, I want each clinical group to get together and one person from each clinical group designated to email today. Because that way they won't be bombarded. But send it as a high importance. You know, when you send the email, how you can send high importance and response. So this is very important. Dr. Moore has asked each one of us to email. See? Because by Wednesday, we all ought to have this settled. Sounds fair? Tuesday's group, anybody in my group have these severe allergies? Are we okay at least Tuesday? We're okay. We will survive. That's good to know. That's good to know. But Wednesday, so that gives y'all time to get this fixed, right? But I do say Tuesday, then Mr. Whitehead have a Tuesday group.
Yes, we'll start tomorrow.
You guys got to email as soon as we have our break. Okay, assist patients with meals, guys. And you see this? This is an old picture. See that?
What is that?
What is that? I didn't show you that in Skills Lab. You know why? We don't.
That look like a bow. We could go with a bow.
No.
They decorated it.
I know, but look, that still is a posy back there. I think that is a posy. Now that's a bib that she has.
Yeah, you don't
under
do
her, but
bibs
I think
no more.
this right here,
Don't do bibs.
that's a posy. That actually looks like a posy vest. Yes, it could be her backpack. No, this is a bib. I think this is a bib.
Ooh, you're not supposed to be using bibs anymore.
But I'm just sure what this is. It's either a backpack
Not a bib, what is
or
it?
it might be a vest.
It's a gown. It's a gown.
Then it's not a posy. It's not a posy. They've gotten rid of it. Except for dome spot. We don't see restraints. No restraint facilities. Chris had a question.
If they're having trouble just sitting on a chair.
Yeah. We're assisting them, and that's a breakaway thing, and we're not restraining them. Velcro is an interesting thing. We're not tying anything. That might be how they get around a lot of restraint laws.
Well, it's not meant to be.
It's just to help them with their costume. Yes.
Yeah.
Yeah. It's just
Oh,
a
the
big,
VA
it's
colleges.
big, you know, with the state, coming in, checking these nursing homes, it's big, it's a big discussion, and they don't want to see restraints on residents.
I didn't see any at Autumn, so which
No.
confused me, is that
No,
none
restraint- I
of them
told you.
fall, none of them fall out?
They have a right, you have a right to fall, but you don't have a right to be tied down. That's what the DON once told my group of my students. And I said, you know what, that does make sense. No one has a right to be tied down. You have a right to have fall. But they try to facilitate lessening the degree of injury by what? They make those low beds. They actually, in some of these resident situations, they'll create a mattress right on the floor for them. I've seen facilities that actually go to that extent for safety issues. They figure out a way to position the bed so that the wall's not called a restraint. You see, this is not a restraint, this is a wall. Right? You see what I'm saying there, right? But in essence, we're trying to maintain safety, but we don't have a right to tell them every which way Sunday. You know, like back in the day, when I first got out of school, because I'm telling my age, right? It was, I would go in LPM school, and those, they'd all be lined up, they'd all be tied down, you know, we thought that's the way it is.
Next week.
We didn't know any better. We know better. We know better. Because why? You know, it makes them more agitated because they're not free. I mean, how would you feel if you were tied like that all the time? See, it's not right. Nice picture of someone being fed. And notice how they sit down. You have to sit down when you're feeding your patient. Everyone
you ain't
makes a seat
standing
when
up.
you're feeding, right? Mine that did it, right? Yes. No, listen, I want you to say loud because might be some, guys, listen up.
What was your concern with not letting us see your patients first?
But here's the thing.
But I don't know if they're, what if they did something in the field?
They're not going to. They're not going to do
Well,
that.
my patient was allergic to latex, and I didn't know if the end of the day, and I was using gloves.
Well, you have to wear latex-free gloves. They should have latex-free
Right, but I
gloves.
didn't know that.
Did you have latex-free gloves?
I have no idea.
You had latex-free gloves there. Trust me, they have latex-free gloves.
They're not latex free on the last hand.
Yeah, I know now hospitals, they don't even allow nothing latex coming in
Guys,
the
the
building.
reason I am very strict on that chart, I'll tell you why. I've had students where they said, well, we got to look at the chart. I said, okay. So then I go by and it's 3 hours later, and guess what students are doing? They're still looking at the chart. They haven't done one iota of anything involving care. Have you missed the opportunity to learn how to feed a patient? They feed them starting bright and early, don't they? You're not going to make a mistake because when you go in, you really don't know who you're going to feed. You don't, do you? You don't know. Because I just had y'all get in there and start helping. You have no idea if that person is going to even be the person that you're going to do your modified assessment and your care plan on. You really don't know. Because what we're there for is to help all. Hence, some of you were doing double feeding, and I said, oh, I love it. Because that's what the need is. See, that's what they need. They need help. They need help, and you guys need help. You need help in understanding and knowing, you know what, I can do this. I forgot your name. Who's the one that did the showers? It was back here, right?
You.
Who was doing showers? You guys know you can do the showers, don't you?
Do
You
we
got
do-
it.
Can we do it by ourselves?
Yes, once that you've got an understanding of the showers. Are you in my group?
No.
I don't, then don't, I'm not talking to you. Yeah. You You have to follow with the CNA.
She ain't about to get in trouble. Look, telling you something.
You have to be introduced, orientated. You have to be orientated to their facility. I can't just tell you go off and do that. Once you're orientated, my group, you'll follow with the CNA and they'll say, well, we're just going to do, you know, these, this, and this person. And guess what? You're going to remember what you did for last week, right? It's going to get easier each time. But if you guys, have you been to the nursing home?
Yes.
Have you been already?
Yes.
You've been. Y'all went Friday?
Yes. Friday.
Y'all were the Friday group. So you had an orientation.
Right.
So yes, well, of course. But you got to go in and
ain't
always
telling you
link up
nothing.
with who the staff individuals. So yes, I speak to you. Some of you guys didn't go to clinical last week.
No.
See? You missed out, sorry. It's a rewarding thing to go to clinical, I think it is.
Well, our orientation is this week, so
Y'all will get it this week.
baby go this week.
And that's fine. And you'll get the gist of it. But you guys, yes, if you've already you were at Autumn Winds, all you have to do is follow with the CNA and she'll tell you who needs showers. I always say work in your couples, right? Did she get you in pairs?
Yes.
Yes, it's safe, isn't it?
Very.
It's safe to do it in pairs. It's very safe to do work in pairs, and also when you're doing your modified head-to-toe assessment or the vital signs, you're there as a support, or if you forget something in your assessment, because remember where this is leading to. Testing. You see why we have limited time, we have such little time. And soon it's going to be over, this quarter's going to be over. We're already in week 6.
Yeah.
We're more than halfway done.
7.
More than halfway. Overweight and obesity. Looks like Dr. Moore there. No. Oh, no. Yes. Yes, I have that gut. It's just hidden. No, it's not. I don't have that gut. Oh, yeah. Oh, yeah. Oh, yeah. I'm there. I am there. I have a BMI of 30 or higher. I do. It's, you know, you don't want me to, do you? So no, Dr. Moore, you don't. But I did. I'm 226 pounds. 226. Well, that might, well, she just, but she falls into but she falls into the same category as I do.
Oh, that might be.
See, she's over her percentage. I'm over my percentage. Until we acknowledge, we have to accept responsibility for ourselves. I have to accept my responsibility. I admit it. I am guilty. I'm guilty of that egg McMuffin and that hash brown this morning. Yes. Yes. It was bad, I did it. But what happens to us, guys? What do? We are in such a rush. We don't take the time to prepare our meal at home. Fresh fruits. Drinking the appropriate, see Ingrid's 3 bottles of water. She's going to be A-OK this afternoon, y'all. I'm having farm. She's good.
She's always A-OK.
Dallas, look at this. Look how, do you realize as I look at the tables, years ago, this wouldn't be here. What would be here is a sugar coat. Has anybody got a sugar coat in here? Who has a sugar coat? That might be a diet. That might be diet. That's a little package you can get sugar-free at Walmart, and there's 0 carbs. I know, but it's still Coke Zero that, if I look to the total carbs, it's 0. It might do away with cancer. Okay, we have one taker here.
One water.